It's a segment we have called Coronavirus Q&A, where we try to take some of the facts and separate them from the fear that is out there. And every Thursday, we've been joined by Dr. Robert A. Frolickstein, an emergency room doctor here in town, and we are very pleased that he's back with us again. What are you seeing in the emergency rooms? Are you seeing the tide turn?
I've been very encouraged. Over the last week, we've had a few new cases, but many more discharges. And in fact, right now, within the whole Methodist healthcare system, we have 15 patients, or 14 or 15 patients with COVID that we're treating. And just to reassure everyone, those are all in a separate area of the hospital. They're being cared for by separate care teams. So a nurse doesn't go from a COVID patient to a non-COVID patient. So it's definitely safe to come into the hospital should you need to.
Dr. Frolickstein, I want to ask you about the reopening of Texas. First of all, how are you at your hospital preparing for it? And how do you think it will impact operations there at the hospital?
So, I think we are prepared. We have processes in place. And, obviously what we're concerned about is if as the reopening progresses, we will see more cases. I think the big fear was early on, and really the whole reason behind kind of closing things down was to prevent a huge surge that would overwhelm our capacity to care for patients with COVID and other illnesses. And I think we're prepared now, and I don't think we're going to see that surge that we're unable to care for people.
Are you still concerned that you're not seeing people that normally should be going to the emergency room? I'm not talking about COVID patients here. I'm talking about people with heart attacks and strokes and that kind of thing.
Yeah, I am still certainly concerned. I think the last few days maybe have been a little bit better, but just as an example, Methodist Hospital is a comprehensive stroke center. It means we have all the latest available treatments for strokes. One of those is a special medication that is very time sensitive. People need to get to the hospital quickly. We're going to use that medication. We normally use that medicine between 10 or 15 times in a month. In April, all of April, we only used it 5 times. And that means there's between 5 and 10 patients who missed out on an opportunity for a drug that might have helped them significantly.
I want to ask you about visitation policies. When this pandemic came about, a lot of hospitals were implementing new policies in regards to the visitation policies where people can't go in and visit their loved ones. Do you see that changing either there at your hospital or throughout the city?
I do. We're starting to relax it again, and we're starting to relax it. And I know that I believe the elective surgery cases can have a visitor now, and I know they're looking at a plan to allow at least a visitor per patient who's in the hospital. It's got to be carefully coordinated. We've got to make sure that those visitors are safe and that our staffs are safe. But I think that's coming soon.
Are face coverings mandatory when you come into the emergency room? I know that the governor kind of made it not mandatory in his state order. City and county officials want it to be mandatory. Is it mandatory when you come into the emergency room?
It is. Every patient is placed in a mask, and of course every person who's working in the hospital also has a mask on. And not only that, they're all screened for symptoms and screened for fever before they enter the facility.
And Dr. Frolickstein, just any final messages for our viewers to keep in mind as we continue to progress along this pandemic?
I'm very hopeful that, there's such incredible work going on around vaccines. There's over 100 people places working on vaccines, and several of them are in phase 1 clinical trials. I still think we're a long way away, but it's just encouraging to see so many really brilliant people working on what we really need, which is an effective vaccine.
Your definition of a long time, a year?
I think it's 12 to 18 months, I think. Yeah.
What are you seeing in the emergency room lately?
So the last week has been pretty encouraging. We're still seeing a few cases, new cases being admitted, but we're seeing much more patients recover, many more patients recover and be discharged home. So the overall number of patients with COVID in Methodist Hospital right now is very low. It's at only 15 patients. And I just want to make sure everyone understands those patients are in a separate area of the hospital, and they're cared for by a separate team of nurses and techs and doctors that don't move from patient to patient. So you're safe coming into the emergency department.
And that's I want to expand on that a little bit, because since we really first started talking, you were concerned that you're not seeing some of the normal cases, the non-COVID related cases that you usually see in the ER.
That's very true, and it's concerning. And just as an example, we're a comprehensive stroke center. That means we have many treatments available for strokes. One of those treatments is a medication to possibly dissolve a clot that is causing a stroke. In a normal month, we would administer that medication between 10 and 15 times. In all of April, we only administered it 5 times. And what I'm fearful of is that's 5 to 10 patients who sat at home, came in too late in order to get that medication that might improve their outcome. So.
And that's why it's so important to get the message out there that the ER and the hospitals are safe.
Correct.
Yeah.
Correct.
All right. First question we have tonight: what are some of the new symptoms of COVID-19 that have been spelled out?
Yeah, so I think the CDC added some symptoms for people to look at, and most of them are really just those symptoms that we would normally associate with any viral illness: headache, sore throat, chills, recurrent chills, and those are sore throat are pretty common with really any viral illness. And I want to remind people that it's not just one of those; it's a combination of those, and they have to kind of present in the correct way to be worrisome for COVID. If you just have a headache, that's not really very worrisome for COVID without some of the other symptoms. Kind of one of the interesting symptoms that they added, which does seem to be fairly unique to COVID, is this loss of taste or smell. And I haven't personally seen any patients with it, but I know my colleagues have, and it's a pretty profound symptom. So it's not a subtle thing, so don't get worried if you just feel like your food tastes a little funny.
Yeah, you're going to know it. Yeah.
Yes.
Is there any evidence, the next question from our viewers, is there any evidence that COVID-19 can be transmitted by secondhand cigarette or marijuana smoke?
No, that really, certainly there's no evidence of it. It doesn't even make any sense by the way we know the disease transmitted, unless you're sharing that cigarette or with someone else. Then of course there would be that risk of transmission.
There's been a lot of talk at the orders that have come from the city and the county not necessarily matching up with the reopen orders that are coming from the governor. Do you think it's too soon to open San Antonio?
Well, that's a very complicated question. From a purely clinical perspective, we don't want to open up until the virus is all the way eliminated. But that's really not feasible. That's like saying that, there's 6,000 deaths on the highway every year in Texas because of motor vehicle crashes. Let's not drive cars. That's just not realistic. And so what we have to do is to put safety practices in place that are akin to a seatbelt on a car to make it as safe as possible. And I know those steps are occurring. I know some of the criteria to reopen are very close to being present. I'm not sure they're totally present yet. For instance, the decrease in number of cases, I think we want it to be a consistently decrease for 2 weeks. I don't think we're quite there yet. We certainly have the hospital capacity now. And I know testing and the ability to trace people is definitely ramping up. So I think we're pretty close from the clinical standpoint. There's a whole host of other factors that go into it that we have to trust our leaders to do the right thing.
Absolutely. All right, next question. I'm noticing a lot of people wearing masks on either their mouth or their nose, but not always both. Do both have to be covered to work?
Yeah, you really need to cover both. The idea behind a mask is to prevent spreading of droplets of saliva, and those droplets can come from your nose or your mouth. So really, yes, they both need to be covered.
How many tests is your ER performing daily? I know you don't know all of them, but let's say in a normal shift for you and your colleagues, how many COVID-19 tests are you usually performing?
So currently, we are still really only testing people that we are suspicious might have the disease and need to be admitted to the hospital or are going to undergo a procedure or an operation. And still that probably leads maybe to a dozen tests per day per facility.
Do you anticipate there'll be some changes in visitation or some ways that the hospital operates now that the reopening of Texas will begin tomorrow?
I do think there'll be some changes. I know that some of those have already occurred with the reopening of some surgical cases. I know many of those patients are allowed to have a visitor during that surgery. And I know are discussions amongst hospital leadership about opening up at least to have one visitor per patient. That's not yet occurred yet. They're planning on it.
I like to do this with a lot of our experts, and I want to give you the final word. What do you think our viewers need to know tonight?
I think that I want to thank the community for all their efforts. This has not been nearly as bad as we had hoped or that we anticipated. And what we hope is that there won't be a bigger second wave coming. And so the way to make that happen is continue to be prudent, even after things open up. That doesn't mean things are back to normal. We're still going to need to take the precautions that we've all learned over the last many weeks.
Dr. Robert Frockstein, as always, I appreciate your time.